Well, varicose veins don't just make you feel self-conscious, but they can also cause discomfort and even become a serious health issue. Getting rid of them doesn't have to be a painful process. In fact, we have Dr. Gropper here, founder of North Beach Vascular and Aesthetics, and we're going to discuss one of the less painful options. But let's start here. Varicose veins, what are they?
Well, they're enlarged veins that form on the legs along with their cousin spider veins, and they form because of an underlying vein problem in the leg that we call venous insufficiency. It's basically blood is only supposed to flow up the leg back to the heart, and in some people the valves in the veins stop working. It allows the blood to flow backwards, and that increased pressure leads to spider veins and varicose veins.
Now, how many women suffer from this? Because I think a lot of us, we look at our moms and we say, oh, our moms have this. Does that mean it is inevitably going to happen to us as well?
Well, it's not inevitable, but if you've got people in your family that have spider veins, there's a good chance.
You're giving me a sad look right now.
Yeah, there's a good chance that somebody will develop it if it tends to be genetic in origin. So
okay, can we actually go ahead and take some before and after photos, and maybe you can tell me some of the treatment options for these conditions? And the bulging veins there are the
yes.
varicose veins, correct?
These are, you can see varicose veins. The two pictures on the left are bulging varicose veins, and the one on the right is sort of a combination of some very prominent spider veins and varicose veins.
Okay, now how would something like that typically be treated?
Well, it's a combination of things. Generally, it's a bit of a process to treat these things. First, you need to understand where the underlying problem is and treat that, and sometimes that might require a laser ablation of the veins that lead into these veins.
Those are amazing results, by the way.
These patients came out very, very well. Look, on the left side, you can see the ankle that before looked really bad, and we got a nice result on her.
And it almost looked bruised before. I feel like that's one of the common effects of those spider veins. But this new foam, tell me about this new foam.
Well, we're using foam a lot more lately. They've been using it in Europe for years, but for larger veins, the foam is more effective at really treating the entire inner wall of the vein. And so we found that on medium veins and large veins, we can get much faster and more complete results.
Now, are the results permanent?
Well, for the veins that we treat, but unfortunately it's a progressive disease, and over time new veins will tend to form.
Okay, so how long does it usually take to get the treatment?
Well, again, it depends. If somebody has a lot of underlying disease in their larger veins, then you'll need to do a laser ablation or some sort of ablation.
Is that the vein disappearing right in front of our eyes?
Yeah, it is. That's a foam injection on some very large spider veins, and you can see it disappear right away. Unfortunately, it comes back, but it takes about 4 to 6 weeks for the vein to completely go away after that.
Okay, is there anything we can do to minimize our risk of getting these spider veins?
Well, there's a lot of things that are touted, things like compression hose. There's some drugs you hear about that make veins go away. Unfortunately, very little of it really does anything. Compression hose, which are really uncomfortable for women in South Florida,
oh my gosh, I can't
will supposedly halt the progression of the disease, but it's not really practical to be wearing those all the time.
Now, I know something like pregnancy can also contribute to the formation of these types of things. Do you often recommend that a woman wait until maybe she's done having kids before undergoing treatment?
Sometimes that's not a bad idea. Pregnancy can definitely exacerbate the condition. We see a lot of young mothers that come in, they've had a child or two, and they've got big veins, and sometimes the veins will actually get better a few months after childbirth, so we like to wait and see.
Okay, well, this has been very interesting for me, maybe for some personal reasons, but for more information you can visit northbeachvascular.com.